So, well, I'd like to welcome everybody to the Medical Marijuana Awareness Seminar. Today's subject matter is neuropathy. And I have to tell you, in researching this and putting this webinar together, I knew a little bit about neuropathy and medical cannabis, but I was amazed about the progress that's been made lately and how much it really does help neuropathy, how it's really been something that's helped a lot of people. This webinar is, as we always mention in all of them, it's very serious. You know, a lot of people that attend this are looking for, they have lifestyle altering conditions and they're looking for answers and they're looking for research. And that's what we're going to probably put together. And more importantly, what I like to do is make sure you feel comfortable that you get all your questions answered. And to that note, at the bottom of your screen down here, you'll see a little Q&A type of a little, looks like two little circles. Please feel free to ask questions, and there are no dumb questions. We're okay with almost any questions. And then also, you'll also see that there's a chat button. We don't really use the chat that much. We prefer the questions coming through Q&A, but we do understand that some people will do things with respect to the chat. So getting started, I want to introduce someone who I've done webinars with before, and one of my favorite ladies. And I'm not saying it because she's here. Jenifer is a person who not only believes and educates and is an advocate for cannabis, but you have lived the experience. And I say that because you are a cancer survivor, although we're not going to, because of medical cannabis, although we're not going to talk about that today. We'll talk about that in 2 weeks. But also neuropathy has been an issue. So I'd like to introduce Jenifer. Jenifer, introduce yourself.
Yes.
Give us your name, what you do, and a little bit about yourself.
Thank you, Mark. Thank you for having me and giving me this platform, and especially letting me speak about two things that are a huge part of my life: cannabis, you know, as a medicine, as where I work, you know, the industry I work in, and neuropathy, something I've struggled and suffered with for many, many years, not even knowing what it was. Right now, I work in the industry. Like I said, I work for Trulieve. I do community education, community outreach. I am very well connected with all the physicians in our area where they are recommending cannabis or have taken the class, and we help them, you know, find the information about the medicine to be able to provide it to their patients. So I spend most of my time, 90%, dealing with physicians and patient outreach. Also, about 4 years ago, I suffered from stage 3 cancer, and long story short, cannabis was a huge factor in me having a clear-minded, clear state of mind to be able to make the health decisions that I needed to make at that time. So yeah, that's in a nutshell, basically.
Great.
What I.
And neuropathy has been one of the problems that you've had to wrestle with recently.
Yeah, and at the beginning, you know, I've had these feelings in my extremities, but I thought it was kind of normal. I was like, I'm toxic from chemo. Before that, I didn't even know what neuropathy was, and you know, I even get it in my abdomen, and I had no idea that was possible. So it's good to look and research. Don't believe everything you read on the internet, because as soon as you research, you're gonna die. But look into your symptoms, because your nerves have so much to do with so many things that are going on with your body, and there's so many types of neuropathy, like we're gonna talk about in the next few slides that we're gonna show.
Yeah, and I think that's one of the reasons why we do this webinar. There's so much stuff on the internet. The question is what to believe. We vet a lot of this stuff. It's all been vetted by doctors. It's been vetted by medical cannabis specialists and scientists. We're kind of hopefully giving you the straight scoop. So I don't want to make this a slideware presentation, but I do think there's some slides that we should look at in order to basically discuss the subject of neuropathy, and that's what we have here. I do want to mention to everybody in the beginning that anytime you're dealing with your health, always consult your physician, both your medical cannabis physician as well as your MD. It's always a good idea to have them in on the discussion. And this webinar encourages the safe use of medical cannabis. That's what we're really doing this for. Medical cannabis can do wonders for a lot of people, but the question is, how do you use it correctly, and what do you use? And that's what it's really for. The goal I have in setting up this webinar series is, if I can make from this presentation tonight, if we can help just one person, help them get their life back, then we've been successful. And that's really our goal. You know, we're just being very humble. If one person can learn and really help, and it really helps them, it'll make a big difference. So first question, what is neuropathy? And this is really interesting because when you look at what neuropathy is, look at little diagrams over here. You have neurons. These are your nerves that are in your body. And what's interesting is the outer sheathing over here. You can see that the protective sheathing called the myelin sheath is basically degrades, and it degrades to the point where, like an electrical wire, when you take the insulation off, sometimes it short circuits. That's what's happening with a lot of your neurons and the electrical signals. What's really fascinating is that when you look at the nerve cell degeneration and the signals being scrambled, your body are receiving and interpreting signals that may or may not be there. And so what's happening is when it interprets it as numbness, heat, cold, tingling, pain. And this goes in your feet, legs. So it's this whole, the nerve system is very sensitive, not necessarily working 100% the way it should, but it definitely is something that's there and it's been degraded. And the question is, what can be done about it? Now, when you take a look at neuropathy, what types of forms, neuropathy can happen all over your body: eyes, bladder, digestive system, your sweat glands. This is something it's something that happens all over your whole body. Now, you hear a lot about what they call peripheral neuropathy. This is in the fingers, toes, and feet. You hear a lot about what they call focal, which has to do with visual disturbances, where people have trouble just being able to be how should I say, uh, being able to just stay present, not have any problems with their walking and things like that. There's types of neuropathy, proximal, which is for the lower body, but the bottom line is it all works the same. It's all the same kind of problem. It's a different set of nerves, but it has the same particular problem that's there. Jenifer, you got any comments you want to make on this?
I mean, just from my personal experience, you know, like I said before, you can have, sometimes we feel like we're superhumans and we don't stop and acknowledge these feelings and sensations we're having in our bodies. And just to talk a little bit about my peripheral neuropathy, I ended up going to the doctor, and the doctor told me, sit down in a chair, close your eyes. And and he goes, open your eyes, he was pinching me with a needle from the middle of my leg all the way down to my fat toe. And I couldn't feel anything. I was like, am I going to be handicapped? Am I going to stop walking? And it was so scary. And it was the neuropathy. Again, there are so many different types of symptoms and different types of neuropathy that you can think it's other things that are going on with you, but it's just the nerves are so sensitive. So just, keep yourself informed and be always in tune with your doctor.
And there's not what's going on may seem strange to you, but it's not strange to the medical profession. It can be
Mhm.
addressed. It's something that's out there. There's a lot of terms that come into neuropathy. You hear vertigo, for example. That's a very famous one. But there's a lot of terms that all these terms relate to neuropathy in one way, shape, and form. And I'm not going to go through each and every one of them. I'm here more to talk about how we solve the problem. But it clearly is an issue and something that the medical profession has clearly recognized. Now, how does medical cannabis help in the case of neuropathy? Well, it's interesting. CBD is really a healer. And what CBD does is it acts as a neuroprotective agent, and it basically puts a sheath around the nerve. It's a coating that it puts around the nerves to help protect it. So although it's not trying to rebuild the nerve, what it is doing is it's trying to protect the nerve. And by being able to do that, it helps to normalize, puts that nerve back in the homeostasis. So it's basically reducing the stress and also the gland activity in that particular nerve. Cannabis also is known to decrease the inflammation and the pain associated with neuropathy. So there is a medical treatment. There is something where the sheath has been taken away and now the sheath is brought back. And you mentioned earlier, Jenifer, we were preparing. There are drugs that do this, but the side effects are tremendous. Why don't you mention that?
Yeah, most of the drugs, I mean, I could probably say all the drugs. There's not that many for neuropathy. They are very strong in the sense of you can't function properly and you can make the right decisions. You can't think straight. And it's really hard to heal that way, when you can't even function. So in my place, we're using CBD. I mean, CBD doesn't, if I don't take a huge amount of it, it does not give me any psychotropic feeling that I can feel, you know? It just takes away the inflammation and the pain, but my mind is super clear. I can do algebra, you know, on CBD. So it's really important for the viewers to understand that it doesn't have to be just THC, even though THC and CBD in a combination is great. Just CBD alone, if you're concerned because you're scared of the high or the feeling it's going to make you feel, if it's going to give you an outer body experience or anything like that, CBD will not do that to you, and it's going to protect the myelin sheath, and that is just magical to me that a
Yeah.
plant can do this.
Yeah, it's something, and that's really really important. Someone from Anonymous is pointing out that, do you mean degree inflammation, not increase? And I don't increase M. I don't understand the question. Um, I took this quote from a medical journal, just for your information, and it did state that it does decrease inflammation. So I think that I'll kind of go with the science right now, and from what people have told me about how this works. I'm not disputing what you're saying. I'm just saying I'm kind of looking at. I don't quite understand the way the question is written. I don't understand it, so I need help there. I need some help there. But if you take a look at medical cannabis, like what types of medical cannabis and what should I use? Well, it's interesting when you take a look at a ratio of high CBD ratios, such as 1 THC to 4 CBD or 1 THC to 20 CBD. It does a tremendous job of reducing the inflammation and also reducing what they call, it lowers the production of what they'll call cytokines, which is something that's really a problem here. The other part of it is THC in high ratios, like a 20-to-1, will actually help to reduce the pain in your body. Now, I have to tell you, be very, very careful about the CBD part. It's not going to kill you, that's for sure. But what it does is if you're just starting out and you know the CBD, before you jump into the 20-to-1, you might want to try a 1-to-1. You might want to go a little bit slower. You might want to mention something about that, about Jenifer.
Definitely super important, because we don't want you to have a bad experience. Remember, if you have a bad experience the first time, you're not going to want to do it again. And it's just about titrating, and we'll talk a little bit about that later, just how to find your sweet spot, how to titrate, you know, that specific perfect dose. But it's all titration and microdosing and going little by little, different formulations, a little bit less CBD, a little bit more THC, little by little, not just a 20-to-1 all in one shot. You don't want to do that.
Yeah, I mean, within the world of neuropathy, there's the medical profession talks about CBD. I should say the practitioners profession talks about CBD as the regulator and THC as the rescuer with what's going on. In other words, the CBD helps you regulate the problem and really get it under control, and THC helps you basically manage the pain, because the pain can be something that's really not. It's something that how should I say, and it the pain is really what you're focused on, but if you don't get rid of the inflammation, the pain isn't going to go away.
Exactly.
That's what I'm putting it. Okay. So one of the questions come up is, of course, now that we know that now we know that CBD basically builds a protective layer around the nerve, and we know that THC can help with the pain. What are the best kinds? What are the best strains that are out there? Now, there's a lot of, you can go out and you can research this a lot. I've gone to a number of different places. These are the 4 strains that have been consistently listed as something that can help with neuropathy. Now, where do you find it? When you go into Trulieve, that you can talk to the person behind the counter and they'll help you with this.
Definitely. And if they go on the shop page, they can also choose what we have available in whatever strain, and it'll lead them to the leafly.com webpage for that specific strain. It'll break everything down, what it's used for, what are the symptoms, that it's used for, what kind of relief it gives. Another thing that I wanted to just mention really quick, sometimes these are great strains, and when you research, you're going to see a lot of different strains, and you'll see that they come over and over, the same type of strains for specific conditions like neuropathy. But, not in every dispensary or in every state or in every medical program we have the same exact strain. So what you guys need to do is start learning about the terpene profile in these strains. What are the high terpenes in these strains that are actually working for you, so that then you have other strains to go to in case this harvest is not ready yet and you have to wait for the next harvest.
Sure. Yeah, feel free to talk to the bud tenders, the people behind the counter. They'll guide you to where they're going. Neuropathy is something that they're trained on, and the remedies for that. These are kind of the ones that are put up. You'll see in a lot of publications, but there are a number of strains that do work. And as long as you're getting something that has the CBD and has the THC in it, and has a mixture that you can handle, that's something that'll help quite a bit. Um, so let's talk about exactly how it works, Jenifer. Um, there's a thing in your body called the endocannabinoid system, and I don't know how many people have ever heard of the endocannabinoid system, but this is something that every mammal has. It was discovered actually in 1940, just before the war, and it wasn't really brought to light until after the war, until they were really doing research into medical cannabis. And Dr. Raphael Mechoulam from Israel really found out that the endocannabinoid system was kind of the backbone of what made kind of the backbone is what made the whole cannabis system work that's out there. And so every animal has endocannabinoids, even your dog, for example, your pets have endocannabinoid systems. So what is that? That's a combination of CB1 and CB2 receptors that are in your body. And you can see over here on the blue side that you see down in here that the endocannabinoid system, what it's doing is it fits like a lock and key with your receptors, and it helps regulate your mood, your memory, your appetite, your inflammation, your immune system. So the endocannabinoids work directly with your CB1 and CB2 receptors to be able to manage your body, best way of putting it. So if you look at where the CB1 receptors are, they're typically in the brain and in the spinal system. And when you take a look at the CB2 receptors, they're primarily in the organs and also associated with your immune system. So this is what's in your body, and this is how cannabis works. It works with a combination of working with the CB1 and CB2 receptors to be able to provide the endocannabinoids that your body needs. So
Fun fact, really quick, sorry to interrupt you. That is how I stop debates. When someone's arguing me, about cannabis, it's bad, it's the devil's lettuce, like, you know what? Just do yourself a favor and look up the endocannabinoid system. That's how I stop it.
Yeah. No, this is something that really, and scientists now have realized that this is a very important part of your body, and that's why they're doing a lot of research on it right now, even with and without cannabis. But let me go back. Hold on, let me go back for a second. But let's talk about how this works. Your nerves in your body, in your brain, will detect that you have a particular problem. This could be inflammation, it could be pain, it could be a number of different issues that come into play. And when your body sees that, it starts producing endocannabinoids. Your brain derives these endocannabinoids. It does that through the omega-1, omega-3, omega-6. It's something this is your body's producing. Now, when you take phytocannabinoids, which is cannabis, when you take it, the buds, the tinctures, the extracts, the CHC, CBD, CBNs, those also work very closely with your nervous system. And in many cases, I use myself as an example. I'm a senior citizen. I don't produce the endocannabinoids as well as, say, Jenifer would, for example. So to be able to augment and to provide my body some of the resources it needs to be able to manage itself is very, very vitally important. There's kind of a saying that anybody over the age of 55 needs cannabis, and there's a lot of truth in that. There's a lot of things that we're beginning to miss out on that we need to take advantage of. But the point I'm making is those work together to provide the endocannabinoids, and endocannabinoids go into your endocannabinoid system, again, regulating appetite, pain, pleasure, sensation, that type of thing. One of the other things that you'll hear about, and you'll hear a lot of, I should say, is synthetic cannabinoids like Marinol. What the pharma companies are trying to do is they're trying to reproduce cannabis. That's like producing an apple. That's like trying to reproduce a lemon. You can come pretty close, but you're not going to get it right. Now, Marinol typically is almost all THC, and it has a very particular purpose for what it's used. And be very careful because it has no CBD in it. It's very powerful. And it should be used only under advice of a doctor and only for a few different medical conditions. So I don't recommend that. I don't recommend synthetics at all, okay? Because we today have better photocannabinoids than we've ever had before. But it's something that you need to pay attention to, and you'll hear about it that's out there. But pay attention to the endocannabinoids and the phytoendocannabinoids, because what happens is your body sees there's a problem. I have inflammation. The cannabinoids come into your body, and what happens is they get stored in your fatty acids. There's this perception that your body, it goes right into your CB1 and CB2 receptors. It does not. It goes into your fatty acids. So when your nerve, it says there's a problem, what it does is it breaks those fatty acids down into long chain fatty acids, and then it produces the endocannabinoids that it needs, and it distributes those through your bloodstream out to where it's at. So what's interesting is your CB1 and CB2 receptors do get the endocannabinoids, but that's done through a combination of a triggering mechanism with your neurons and with your fatty acids to produce the medicine yourself. Now, I like this slide for two reasons. Number one, what it shows is how this works, which is your body producing its own medicine. One of the reasons why no one has ever died from cannabis is because all cannabis is your body producing its own medicine. You can get sick if you take the wrong kind or you take too much, but it's not going to kill you. That's the important part. There's nothing here and no one's ever died from using medical cannabis or from cannabis at all. And this is the reason why. Again, it's taking care of itself. The other is we hear a lot of what they call the entourage effect. And the entourage effect is I'm taking cannabis because I have a pain in my shoulder and I'm going to try to adjust that pain. And then all of a sudden the inflammation in my knee goes away. And you say, well, gee, what happened? What's going on here? Well, the nerves in your system know where the problem is. Your nerves don't need a doctor to tell you where your problem is. Your nerves know where it is. And so when the nerves see there's a problem, it then activates the cannabinoids that are in your system, breaking them down into long chain fatty acids and treating them. So your body has the ability to chew gum and walk at the same time. It can treat your shoulder and it can treat your inflammation. And that's why a lot of people are just shocked by the fact that they have endocannabinoids in their system and all of a sudden a couple of things get taken care of. And this is called the entourage effect. This is something that pharma drugs don't do at all. And this is one of the reasons why cannabis is so popular. You have any comments on that, Jenifer?
A high believer of the entourage effect, definitely. And it's just amazing how this plant works, you know. Again, talking about the endocannabinoids that are naturally provided from us in us humans, from us humans. I always like to bring up the fact that women, when they're nursing their children, they are providing cannabinoids through the breast milk. So it's there again, back to the myths and the disbelief of the endocannabinoid system.
Yeah. We have a couple of questions here. What I might do is I might take a couple before we go too far down the line. The one question is about white widow. It says it has sleep indicating properties and boosts your energy. It does both. Can you comment on that, Jenifer?
I have seen strains and doing research about, you know, my own self and finding the right strain for myself. There are, for example, sativas that are thought to be more towards an uplifting feeling that do cause sedation. So it varies. It depends on the strain and what their lineage is.
Yeah, and then I want to also tell you that it's not only the strain itself, but also it has to do with the terpenes. Because what happens is, in many cases, the terpenes also take over, and they modify the medical properties. And so I know there's a number of supposedly high sativa type products that actually are some of the best sleep aids that I've seen out there. So it just has to do with some of the modern technology that's being put into place. But that's not uncommon, and I think that I wouldn't worry about whether White Widow works or not. It does. It has some great medical properties. One of the anonymous questions asked about different ways of taking it, oral versus topical. We're going to address that question in a few minutes, so I'll just put that off for just a second. Leona asked a question. That's a kind of long question. You've not been diagnosed with neuropathy because of insurance purposes. But you are feeling in your fingers and in your toes. You're feeling the properties that are there.
Yeah,
Look,
she has to put them underwater to like thaw them out. I know that feeling. Yeah, terrible.
Yeah, so that's a very common problem. Yeah, you clearly do have. It sounds like you clearly do have neuropathy. No question about it. Maybe not being diagnosed, but it's something that maybe medical cannabis can help you with because you're showing all the symptoms that are there. I'd be surprised if you don't have it and something couldn't help you there. And I'm not recommending something you should talk to a doctor, naturally, medical marijuana doctor, but it's something that could probably help you quite a bit. What's your thoughts, Jenifer?
Same. I agree with you right then and there. You know, once you get that diagnosis, I know how important that is. You know, that's a breakthrough for someone, especially when you've been looking for a diagnosis and have had all these pains and these bad feelings and the weirdness, like why are my fingers getting locked, you know, and why is my body acting so weird? Once you get that diagnosis though, that's it. I mean, that is a qualifying condition. And once you see that referring that recommending doctor in 10 days, you can start using medicine. And, you know, from what I've seen and I've experienced myself, and I've dealt with thousands of patients, it works amazing. And it works in a really quick manner. Like you can feel some type of difference right away.
Yeah. One of the other questions that comes up is it says there is also in training effect where the substance encourages an increase in the body's own production. Does this happen with cannabis? And I'm trying to figure out the production of what. But the answer is cannabis is a stimulant for your body. It's also relaxing for your body. So in many cases, if you need to produce something that will help, like for example, the sheath that goes around the nerves, okay, that's something that needs to be produced. And that's something that cannabis, CBD, is known to do. And that actually helps relieve a lot of the pain and a lot of the suffering that's out there. So the answer to your question is yes, cannabis does cause that to happen. And it's something that is proactive in those particular areas that are there. Um, so let's move on for just a minute. Let's talk about in medical cannabis, what is CBD and what is THC? Jenifer, you want to take that?
So CBD, oh, we all know what a CBD is. It's cannabidiol. That's the entire name, and it's a non-psychoactive cannabis component, and is also found in hemp. So you will see that if you don't have a medical marijuana card, you can buy CBD hemp products out in the drugstore or gas station or whatever the case might be. Um, and then that's just one cannabinoid, one of the most popular ones. But the most popular one that, you know, a lot of people know about, it's THC, tetrahydrocannabidiol. This is the psychoactive cannabis component, and it's the main cannabinoid that helps with pain. Okay, so CBD, think of CBD for inflammation, and then the THC for pain.
That's a good, that's a very good way to break those down, because I think that everybody wonders about what's out there, and people worry about THC. Now, taking too much THC can cause a problem, but taking a little bit of THC does not cause that problem. And so it's something that, again, when you're dealing with a medical marijuana doctor and you're dealing with a professional dispensary like Trulieve, they'll help you be able to regulate that so that doesn't become a problem. And that's what medical marijuana is all about. That's how it differs from recreational marijuana. But if you take a look at this is called the CBD wheel. Cannabis itself has over 450 medical properties that they've been able to find. Now, if you take a look at this portion over here, the CBD part, and especially the green part, this is the part that has that the cannabis that the marijuana has. This is the part that hemp has, and you can see it has a lot of medical properties. When you put those two together, there are 108 medical properties to CBD, as you see it on the left-hand side over here. When you mix it with THC on this side, there's over 450 medical properties. So what you're finding out is 1 and 1 is almost 3 that's out there. And THC is very good for things, for example, like relieving pain. I went through a knee operation and I went through a lot of pain. And I have to tell you, I used some Delta 8 and it's better than Percocet. Not it not only reduces the pain, but you're not high. You know, you're not crazy. I was able to function as a human being and still be able to get rid of the pain, and that's really important. So there are combinations, and when you put CBD and THC together, the CBD helps regulate the high effect that you see in a THC. So that's also important to be able to put those together to have those particular properties that are out there. And naturally, you have the THC portion of it. When you put both of those together, that's when you drops into the entourage effect, and that's what's very, very important. Now, you hear about hemp and you hear about cannabis. What's the difference, Jenifer?
So hemp is the term that's used more for the industrial type of cannabis. So they're all cannabis, right? It's the same cannabis plant genius that it comes from, but then they're a little different. So the hemp plant is, like I said, used more for industrial purposes, as you can see here. You can use it for fuel, of course, for teas and juices, for mulch and compost, textiles, building. I've actually seen a concrete made out of hemp. It's hypoallergenic and fireproof. Paper, topical ointment, soil conditioner, great soil conditioner. You guys should look into that. It heals the land. It cleans the land in 2 years. foods, and again, industrial products, and that's hemp. Medical cannabis, cannabis indica is the scientific term, is a bit different. You know, this is the medicinal plant. This plant is rich with trichomes, as you can see here, and it's pretty much has all the components of the plant. It has the terpenes, the richness of the terpenes, the flavonoids, the cannabinoids. It has THC. Um, so this is more for the medicinal use, right? To extract oils from it,
Right.
versus
Well,
the hemp plant, which is more of an industrial use.
yeah, I think when you take a look at the two different plants, one of them, if you take a look at the hemp plant, it's kind of a stalk.
Mm-hmm.
It's kind of a tree type affair. It's very stocky. The leaves actually it takes 8 times more hemp leaves to produce the same amount of cannabis oil, tincture oil, as it does for cannabis, because cannabis is more of a weed. It's more of it's more of a juicier product. Is the
Yeah,
best way
it's
of putting it.
dense. Yeah.
But that juiciness that you find also over here not only helps produce the trichomes, which is what we're looking for, but also it produces a lot of the terpenes, which are
Mm-hmm.
important for both. It's important to point out that hemp has CBD in it, and so does cannabis. Hemp, when it produces CBD, will produce a little bit, 0.3% THC. That's called full spectrum. That actually works a little bit better than 100% CBD, because it gives you that entourage effect that's out there. But again, if you're worried about being tested for medical cannabis, you probably want to stick to the CBD only kind of product. But the medical cannabis product is something that's more headed in the medical area itself, and obviously they call it weed for a reason. It grows like one. Is the best way of putting it. Um, but let's talk a little bit about what we've heard in the past and what we've seen. When I got in the industry 6 years ago, all I heard about was sativa and indica. The sativa indica, go do this, go do that. There was like this wall that if I wanted to have a lot more energy, I go to the sativa side. If I want to go to indica, I go to the. If I want to relax a little bit more, I go to the indica side. They physically are different looking plants, although they're in the marijuana family. But over the last couple of years, there's been a lot, like the last 6 years, there's been a lot of research to take that indica and sativa as a base and really turn it into cannabinoids. You might want to mention that, Jenifer.
I'm sorry, what was that?
You might want to mention about the cannabinoids, the strains, the hybrids that are being produced.
Yeah, definitely. I mean, and nowadays, if you research in Google, like I said, Leafly or any of those type of websites, you'll see that there's hundreds and hundreds of types of strains. But you know, it's all about the it's kind of like a fingerprint. You know, what makes the strains? It's gonna be a formulation of cannabinoids, terpenes, and flavonoids. That's gonna make the strains, and with time, cloning and breeding, mostly what you will find is a hybrid strain. Now, in the industry, we do like categorizing them according to the profile of the cannabinoids and the terpenes. You know, if they're sedating and they make you sleepy, you know, they're going to be on the indica-like side. And if they're going to make you alert, they're going to be on the sativa side. But technically, most strains that you're going to find are hybrid strains.
Yeah, especially today, there's very few, let's just say, pure strains that are out, pure
Mm-hmm.
indica or pure sativa, or sativa or indica. But the terpenes are really important. We're going to get into that in a minute. But before we do that, we should mention every person's body is different. Notice that when this was being distributed through your body, it was going through your blood system. It has to do with your metabolism. It has to do with the way your body works, the way your body produces its own endocannabinoids. So when we start in the cannabis world, we like to go what they call go low and go slow. Probably starting with a 1-to-1 type of a ratio, so you can figure out what your body can tolerate, it can't tolerate, and if you need more something to help you on the pain side, you can increase the ratio of THC in it. And if you need more from the standpoint of inflammation, then you can increase the amount of CBD that's in there. So that's what's important: is really work with your doctor, work with your dispensary, and really be able to get that dosing right. I know that when you do that, you really will get your life back. And it took me about 2 weeks to get my dosing correct, but after that, my life has been wonderful. It's made a huge difference. Your thoughts, Jenifer, on dosing?
I agree on that as well. It's a journey that you have to go through. Your doctor is not going to tell you an exact dose that's going to be the miracle sweet spot for you. It's something that you have to work on yourself, you know. And I talk a lot about just jotting down what you're taking, when you're taking it, and how is it making you feel, how long is it gonna it's taking, just so you can start compiling a list of things that actually work for you.
Mhm. Yeah, that's important. And again,
Mhm.
your dispensary will work with you. So will your doctor. We'll talk more about doctors working with you as all. But we've mentioned this thing called terpenes, and really terpenes are important because the endocannabinoid system is kind of like the highway in your body that everything travels on. The driver is the thing that pushes it through the blood system is called the mandanoids, and the cannabinoids are the passengers. That's the relief that's being taken to that part of the body. But really, the terpenes really help you navigate and really sharpen what you need to be able to address that particular problem. It's really interesting how when I first got into cannabis, I couldn't figure out how when I went to a dispensary, they had my profiles, what was the problem. And they would look at me and they'd say, okay, here's the products I recommend. And when you go into a dispensary, you look at 200 products or 300 products. How do they know out of that one what worked for me? That has to do with the terpene profile. They know that terpene profile will provide me the relief that I'm needed. Let's be a little more clear about what we mean by terpenes here. So you can see that they have certain effects where they found medical benefits. You want to talk about terpenes for a minute? Because that's one
Yes,
of your favorite
I
subjects.
love talking about terpenes because when I was in my cancer journey, I tried so many natural things. Of course, you immediately start searching and looking, and I got involved in essential oils, and ingesting them and using them in my skin and things like that. And terpenes are very similar. They are actually the essential oils of the plant. Here we can see the most popular ones and the effects that they give you, but also the medical benefits. And you see in the middle column, you'll see what types of items, food items, spices or herbs you can find these terpenes. Now, I always like to bring up the example of being in a room, just enclosed, and having a vaporizer on with linalool oil, lavender oil. Once you start breathing that air for a few minutes, it starts making you feel sedated. You breathe it in and you feel good, you feel sedated. You might even yawn, and that's exactly how the terpene profiles work with the cannabis plant and the human body. The different terpenes make you feel a different way. If it has too much pinene, it's gonna make you alert. If it has limonene, it's gonna give you stress relief. If it has linalool, it's gonna give you relaxation. So learning again about the profiles of the plants that work for you, just as a reference for future types of terpenes,
And
is
also, when you
very
go into
important.
the dispensary, feel free to ask the person behind the counter. You're recommending this. I know it has this particular property based on a medical condition. Why? And they'll probably tell you about the terpenes that are there. But it's a great
Definitely.
educational process because this is a science. This isn't like, hey, let's go smoke a joint out back and I hope like hell it works.
Yeah,
I
no,
know.
no. This is like you're gonna find your spot if you pay attention and you jot everything down and you go through the process of helping yourself. You will find what works for you.
Yeah, and it's really fascinating because I know that when I was growing up as a boy, I lived in the San Francisco Bay Area, and we go to these Chinese doctors, and you describe what your problem was, and they turn around and pull a bunch of things out of boxes, whip up a tea, and you go home, and it would work.
Yeah.
And it dawned on me when I went to the medical cannabis dispensary, in essence, that somebody's already put that stuff together, but they already know
Yeah.
what terpenes you needed with the cannabinoids you needed to address your particular situation. They're honing right in. And a lot of folks when I got in the industry said, oh, I'll just smoke a joint and stand out front. Yeah, that's kind of using one. That's like using 151 Bacardi because you want to have a pool
Yeah.
party. You
Yeah.
know, when you're using medical cannabis, you're able to get the effect that you want to be able to get rid of the inflammation and get rid of the pain, but you're not necessarily high.
Yeah.
You can still get high if you want to do that. That's your call.
Mhm.
But if your objective is to solve a problem, in my case, for example, I run 6 websites and 7 social media networks. I guess I could be high. I don't know, but it
Amazing.
wouldn't be any it wouldn't be any good to anybody. I clearly have a job to do. So
That
you've
is
got
such
to
a
stay
great
coherent.
example. That is such a great example of how functional you can be while using cannabis.
Sure. And that's what's important. And that's why Percocet and those types of things when I was in an auto accident and had ended up with herniated discs in my back and 7 herniated discs in my neck. Percocet's not an answer because all it does, it makes me a zombie. And that takes me out of the game to be able to help people and be able to do what I need to
Exactly.
do. So But terpenes are very important, and please pay attention to them going into the future. Um, Jacqueline Small asked a very interesting question, and I think I want to address this one. It says your doctor gave you a referral form to apply for a card, and you've not sent it in due to your employee's substance abuse policy. Could this impact my performance, and how will this be viewed differently from recreational drugs? You know, what you're really talking about is what's the policy of your particular employer. And again, this is something that we can't regulate. It's something that your employer has. There's certain employers that just say have 100% tolerance that are out there. And if that's the case, then I would be very careful about turning in your card, because if they do drug testing and they find CBD or THC, it could cost you your job. So you're right about being careful about doing that. On the other side of the coin, you'd be surprised how many employers today have really come to light when it comes to this. I jokingly say I'm from California and I worked in Silicon Valley for 38 years. And if they went in and they tested and they fired people because of cannabis, we wouldn't have any employees in any of the high tech companies. No, I'm serious. I mean, it's just
be in front of the computer like that all day long, I bet.
Yeah, you know, you can do what you want to do, but if you want to get that product out the door, you really have to pay attention to what's going on. And that's why, you know, a lot of artists who are on cannabis actually become better. They make better music. Um, it is something that depends on the company. Now, I'm not suggesting that people go to work high. That's not what I'm saying.
Yeah.
What I'm saying is a lot of companies are very tolerant of CBD. You'll be amazed how many managers of companies, how many HR managers realize the benefits of CBD without necessarily the THC, just a little bit of the entourage effect, and it makes a difference. I wouldn't necessarily say, it depends on your company. You're going to have to talk to them. I would approach it with HR, but if you have a zero tolerance policy company, don't go do that, because all it's going to do is get you into trouble.
Yeah.
It's kind of a unfortunately today it is still a bit of a touchy subject. And
I want to mention something really quick before you move from the slide. The
Yeah.
terpene humulene, it's like it's exactly what it says there. Suppresses the appetite, because there's a lot of myths about cannabis, and a lot of people are apprehensive to use cannabis because they feel they're gonna gain weight, and they already have weight issues because they're inflamed. They have inflammation. A strain with high humulene, you know, will help you suppress that appetite, and that is amazing.
That really helps quite a bit.
Yeah. Definitely not recommended for someone, for example, on chemotherapy that needs to open up their appetite. Low strain, low humulene. So see, that's the way that you can kind of learn more or less, you know, what to use and what to not use.
Sure, how it can help that's out there. Now, we had a question earlier about dosing, and so let's get into that. There are a lot of different ways to take medical cannabis. I know that when I got in the industry, I started thinking, I don't see my mother or grandma sitting on the front porch with a doobie, that's for sure. But we have moved so far past that in this industry. You know, I think those are the old days. Let's put it that way. There's a lot of different ways to be able to take cannabis that's out there. Here's a better chart. You want to take us through this, Jenifer?
Yeah, so this is really important because different routes of consuming cannabis affect you differently in the sense of the onset, meaning how fast it starts working, and also the duration of the onset, meaning how long do you feel the effects for. So here you can see the different types of routes. For example, you have the sublingual, the vaporizer, the capsules, edibles, topicals. Edibles and oral, you can always compare the same because they're going through the same type of process. And you know, we have the transdermal, the flower, and the concentrates, of course, and inhalation nasal spray. But then you see that all these different products work at different times. Like, for example, inhalation is always going to be the fastest. A lot of people also are apprehensive to inhale, but you don't have to smoke. You can just vaporize. You can vaporize flour, you can vaporize oils, and that is going to be an immediate relief, right? So if you're having a breakthrough pain, it's preferable that you maybe combine an inhalation product with an oral product. So inhalation will act immediately, you'll feel it immediately, it'll help you with that breakthrough. But to prolong the feeling of relief, then you should do something like a capsule or an edible or an oral. That'll take longer to kick in, but then the relief will last longer. So basically just figuring out what works for you. The topical it's a little different because that is a neat basis. You can put that on as many times as you want. You're not gonna get that psychotropic feeling at all whatsoever. But just be aware that sometimes if you only do the inhalation, you're gonna just nip it in the butt of the moment, but the prolonged you're not gonna have. And if you do oral only, then you're gonna have to wait a long time, 45 minutes to an hour, to feel the relief.
Well, and I think it's important to point out in my particular case,
Mhm.
when I wake up in the morning, my level of pain in my neck is somewhere between a 7 or an 8. That's just the way it is. I've learned how to reduce that now, again, after working on my regime. But when I wake up in the morning, classically what I do is I take some sublingual drops to be able to address that. By the way, that is a ratio of 4 THC to 1 CBD to be able to address the pain. Now, it takes typically for me about 20 to 30 minutes to work. And I don't like to be in pain, that level of pain, for 30 minutes. So I grab a vape pen and I immediately take 1 or 2 hits out of the vape pen. And I have to tell you that within a minute to 3 minutes after I take a hit out of the vape pen, the pain is gone. And the first time that happens, the first time you take a hit out of that vape pen and you have that level of pain and it goes away, I remember I said to my wife, "What is going on? This is just, you have got to be kidding me." It was like somebody took a rag and put it on my back and just wiped away the pain. And even when it happened again this morning, I'm always amazed at how fast it works. There's one pen I use. It's a Delta 8 pen that's used for pain management, and it's better than Percocet. This stuff just works. And I don't really like, I'm not really, it's hard to work when you're under pain. It's hard to be productive as a professional, but if you can get something that helps you do that and not get high, that's really, really important. Um, a lot of people ask what's the difference between taking a capsule and a sublingual drop? Well, the sublingual drop goes right underneath your tongue, and underneath your tongue, you have membranes that allow that sublingual, that allow the cannabis to immediately get into your digestive system. It goes through the mucous membranes in your mouth, and it goes right into your bloodstream. So it's a very efficient way of taking cannabis. When you take capsules, what happens is the capsules, and the edibles are the same way, they go into your stomach. Now, it takes a little bit longer for it to work, but it works a little bit longer when it's there. But what happens with the capsules is that your stomach, because your stomach lining, will burn off and probably consume about 20% of the cannabis. They'll just go away from the way your stomach works. But it takes a while for your stomach to break it down and for your digestive system to get into play. So a lot of people prefer sublingual drops because it's faster and cheaper, but that doesn't mean the capsules don't work. And I think one of the things that you got to be careful of is people really love edibles, and edibles are very popular. And I'm a huge edible fan, but you got to be very careful. Give edibles time to work. If it says takes 15 to 20 minutes or for 30 minutes, wait the 30 minutes. There's
I
famous
also
stories.
recommend, Mark, I also recommend breaking it in half. That one edible, it's 10 milligrams or 5 milligrams. Cut it in half and try like that first before you do the whole dose.
Right. But that really comes into play. But I know that the gummies and brownies and things like that are really great. My mother uses cannabis for her cancer. She's actually battling cancer and has been battling cancer successfully now for 2.5 years. And she's the gummy queen. She carries gummy with her all the time.
That's awesome.
And it's something that it's just easy for her. It's just easy for her to take. She doesn't have to worry about the drops. It's easy to carry.
It's discreet. Yeah.
So I think it's something that's there. One of the things that is important are transdermal patches. And again, I'm a big patch fan because you can put this on a CBD or 1-to-1 or THC patch, and it'll last for anywhere between 8 hours to 72 hours. That's out there. What that does is, in particular, in my case, I take cannabis in the morning when I wake up. I have to take it at midday, and I have to take it at the end of the day. I'm dealing with a very severe pain problem, and I'm dealing with a very severe inflammation problem. And so I have a regime that really requires three treatments a day. Now, what's interesting about the transdermal patch is I can put on a patch, and it means that I'm still treating during the day, but the supplementary drugs that I'm using, supplementary cannabis that I'm using, I use a lot less of it. It's easier to take. Just makes my life a lot easier, which I think is great.
Definitely. And I want to just mention in the neuropathy topic, anything topical, very underrated. You would never imagine that a topical formulation would help with your pain, sometimes more or the same as pharmaceutical drugs, and it's amazing, and you don't get high. So
Yeah, Leona, you were asking, do I vape flower or do I vape pen? I use a vape pen. I prefer the vape pens. Um, I never really was never a flower person, let's put it that way. But what I love about the vape pens is I can dial them in, just like I dial into tincture drops. So I can dial in high level CBDs and CHCs, and candidly, in many cases, I think it tastes better. But that's just my own preferences that are out there.
Mhm.
But that's my preference. I'm a vape pen person. I'm not anti-flower. It's just I'm a vape pen person. It's something that I tend to do,
But
and it is something
definitely
that I do
thinking of
pay
a
attention to.
combination of a few of these, types of routes should
Mhm.
work or would work best. A combination of things, attacking your issues in different ways.
Right. Shannon, you asked a question that came in through the chat. It says you're noticing pain consistently in your shoulder muscles, and occasionally it'll accompany numbness in your forearms and hands. That sounds like neuropathy, doesn't it, Jenifer?
Mhm. Yeah, that
Uh,
sounds like
I
it.
would I would have first of all I'd have a doctor look at it because you're probably dealing with neuropathy itself. And again, I'm not anti-doctors. It's just be careful of the drugs that they give you.
Mhm.
When I had my accident, my auto accident, they gave me some drugs that, honest to God, I couldn't sit on the couch. Honestly, I was. It was. I called the doctor a day and a half later. I said, "What the hell is this?" He goes, "That's the normal prescription." Man, and I thought, "Whoa, this isn't going to work." I went immediately to medical cannabis because I have to function as a human being. I do want to get rid of the pain, but I have to keep my senses about me. That's what's important, and that's what I'm saying here. Please talk to your doctor about this. But I think that you have a good chance of being a candidate for using medical cannabis for this. And it sounds like neuropathy, or or a what do you call it, a sciatica problem, one of the two that's out there. Um, Paula has asked the question. Do you want to see this one, Jenifer? She uses a
Paula.
Trulieve topical gel.
Mhm. Okay, we're in the pain relief, incredible presentation. Yeah, and we are working on that, Paula. Actually, I was meeting with the team this morning in regards to that and getting that to their pipeline. I know it's ready to go. They have the formulation ready. We should be seeing it at the stores shortly. But definitely, like I said, it is underrated. No one would ever think that a topical cream can help the neuropathy pain so much. And I am gonna emphasize, for me it did not work to use it once in a while or once I had a chance. No, it worked when I used it continuously for a long period of time. I used it for a couple of weeks. My neuropathy in my right hand was so bad that I had to get an electric stapler because I couldn't do the function of stapling anything with my hand because it would burn so badly. And let me tell you, I started using the cream once in a blue moon and I'm like, ah. And when I started using it continuously, it was from night and day. Now I rarely use it. I put it to like just when I know it's a day that I feel like the stiffness is coming on, I'll put it on. I don't have to put it on all the time. But let me tell you, I also get jaw pain right here sometimes, like lock jaw, and it works here too. Amazing. And it's just a cream.
It's interesting when you really start using it, what you find out what it does. Now, um, one of the things I want to mention about being out of stock, Trulieve does a great job of trying to keep products in stock. And I know in dealing with them and some of the other dispensaries, there has just been an incredible run on cannabis products, not just in Florida, but across the United States. And I know a lot of the dispensaries are doing what they can to keep things in stock, but it's an unfortunate situation. Don't get down on your dispensary because of it. I know you're doing, Jenifer Trulieve's doing everything they can to keep things in stock. It's just that demand is really abnormal.
Yeah.
And it's
I,
something
I
that
also want you guys to keep in mind that the process for the laboratory testing, remember we do third party lab testing. So we test in-house, but we also have to send it out. We have to send it out to third party. The process has changed. So that's also holding things back. But I'll get someone to reach out to you, Paula.
yeah. Yeah, the answer is yes, they're working on increasing it, but again, it's a process where you have to follow it with the testing and everything that goes with it. But it's something that, fortunately or unfortunately, welcome to the times, put it that way, especially on high CBD products. Um, One of the anonymous questions that came up is, does the state of Florida have any plans to pass legislation preventing decriminalization against employers who use medical cannabis? Well, let's break this question down. State of Florida has no plans to do anything. Okay, I mean, to be candid with you, there's a lot of lobbyists and there's a lot of industry influencers that work with the legislators and work with their aides to really come up with products and solutions that we should be using. I know that Florida right now is still trying to figure out, like all states, they're trying to figure out what's the best formula for what to do with medical cannabis. And it's probably done one of the better jobs of any states in the union right now. From a decriminalization standpoint, there is a massive effort on the federal level. Let's start there. And I know that there's been a lot of work being done to be able to introduce legislation to decriminalize cannabis at the federal level, to start there. And I think once it gets decriminalized at the federal level, it'll be like a domino effect that falls into the state level. Now, in defense of a lot of states, they have decriminalized cannabis in their states, not just blue states, but red states. It's amazing how many states have gone in and decriminalized cannabis right up front. I think there's a movement. There's no question. There's a very strong movement in Florida to decriminalize cannabis. I think it's just hard to read the tea leaves with respect to politicians, especially here in Florida, because I know on one side we're very pro-cannabis, and in another way we have a very strong pharma lobby that doesn't want us to exist. So if you can live with that yin and yang, all I would say is stay tuned.
Yeah.
I would say
And I do want to mention,
the wind is to your back to get decriminalization, though. Let's put it that way.
I do want to mention I am out there in the community a lot. I mean, not so much now because of COVID, but I have been in the past few years. And there are many people working really hard for the people. And, you know, just think back to 2015 when this program came into play. This was only CBD for terminal patients. It's just opened up to so many other conditions. And not only that, we have hundreds of products, so many different qualifying conditions. So it's opened up, you know, and the work that's being done, you know, the lobbying and all that stuff, it's working. And there are people out there continuously. We can't stop though, you know, we can't stop. There are still things like the employment issue that need to be addressed, that need to be taken care of.
Right. And there's a lot of issues, and there's a number of people that are right now doing a lot of work in this particular area. I know Chris Cano here in Florida is doing a lot of work with Normal Central Florida. It's called Suncoast. So there's a lot of people out there trying to make this happen. Unfortunately, our governmental system moves slowly, but hopefully within the next year or two, we'll see a lot of progress being made with the new administration. We have a much more favorable administration towards cannabis. One of the things we hear a lot about, Jenifer, is what they call full extract cannabis. What is that, and how does that work, and how does it affect neuropathy?
So full extract cannabis oil is also known as Rick Simpson oil, or RSO. This is made in a way where all the components of the plant are kept. It's usually used in an oral manner or topical manner. And basically, you know, the Rick Simpson story, you guys can look it up. It's very interesting. An engineer, he had melanoma in his skin. Long story short, he made this recipe with the cannabis plant and started applying it to his skin and the melanoma went away. With time, he perfected the recipe and has helped I want to say hundreds of thousands, but thousands and thousands and thousands of people get relief. I don't like to say kill the cancer cells or take away the cancer, but there is research that shows that, you know, the apoptosis
it does starve out the cancer cells, and Dr. Christine Sanchez in Spain has proven that that's the case. And Rick Simpson oil does a lot to be able to cause that effect to happen.
Yes.
The point is, the full extract cannabis oil is something that's very healthy for your body. Extremely healthy for your body.
And this is something that you can use, you know, there's different regimens, you know, there's a 60-day regimen, 90-day regimen, 60 grams in 90 days. You start very little and you work your way up, and it's kind of like healing your body. But and also you can use it in very small micro doses, you know, during the day. I like to talk about finding a regimen. You know, the physicians will help you find that regimen, but it is you yourself that knows yourself best, right? When do you get certain pains? When do you feel what? What are you going to do and when? When are you going to do inhalation? When are you going to do the oral? When are you going to do your combination? So finding a regimen is really important. Also microdosing. Start with little tiny doses of your standard dose, just to start getting your body accustomed to the plant material. And so you can also start little by little figuring out how it's making you feel, right? I always talk about trying it, especially for the first time at home, comfortable, when you don't have to do anything else, you know, you don't have nothing to do or nowhere to go. Titration. Working the dosage, starting with a microdose and then starting to increase it little by little, increase the amounts of times per day, increase the amounts of milligrams little by little, just like you would taper down on a prescription medication that maybe you're trying to not take so much or eliminate. You would start titrating up with the cannabis little by little. And journaling, this is really important. And a lot of people think like, I don't want to write a journal, that's too much work. Just, it doesn't have to be nothing too complicated, just a little cheat sheet where you can put, you know, what you took in what form at what time and what did it make you feel, so you can start keeping track of what actually works for you. So these are little tips that I like to tell the patients so they can, you know, have an easier way to finding that threshold, that sweet spot that gives them the homeostasis, like we like to call it, the balance.
Yeah. And
And
Rick Simpson RSO is strong. Best way to put it.
very, very, and you have to take the start low, go slow term very, very serious. So yeah, very, very strong. You take very tiny doses and you work your way up.
And it's very effective. But the point is, because it's very effective, go low and go slow, but it'll do a lot once you start using it. I found it to be a wonderful, wonderful option.
Yeah, like how Marc was saying, introducing CBD to it as well is going to help you feel less of that psychotropic feeling and making your own ratio.
Right. That makes a big difference. Okay. It says, now, one of the questions here is, can I do chemotherapy and cannabinoid products? Jenifer, why don't you tackle that one?
Well, I sure did. That was the best decision I ever made, let me tell you. It helped me so much with my mood, my appetite, and the pain, of course, and the fatigue. It helped me so much with the fatigue. But yeah, definitely. I mean, I'm not a doctor, but you know, discuss it with your doctor. But definitely, cannabis has shown to be such a great aid going through chemo radiation, because you know, I went through chemo radiation. It was very aggressive, the chemo radiation that I had to take, and I don't recommend it to anybody else. But yeah, I mean, medicine is medicine, and sometimes that there's nothing else you can do. But as an adjuvant, cannabis works amazing to help those side effects and all those bad feelings that come with the chemotherapy and the radiation and the aftermath of all that, you know, because after you're done with chemo radiation comes the aftermath, the side effects of years and years of having issues.
Yeah. So very effective for that. Very effective. A lot of doctors, in fact, a lot of oncologists are recognizing that as well. So tell me a little bit about Trulieve. Tell me, you have a very cool thing called nanotechnology, True 2 Nano.
Yeah, so Trulieve's been around for a while, and we've been the first ones to bring out, you know, all kinds of things like deliveries and flour and things like that. But True Nanotechnology, basically they break down the cannabis product into very small particles, and when you consume that, the body's going to take more of the product, so you're going to need less of the product to be able to get the effect that you're trying to reach. And these come in different types of formulations. Now they are water soluble. You're going to feel a quicker onset as well, and very discreet. For example, the tincture that you see there comes in two ratios: one part THC, one part THC, 8 part CBD, and then we also have the opposite. This you can use, let's say, in your morning tea. You can just put a couple of drops in there, whatever your dosage is. Nobody's gonna know it's cannabis. It's not gonna smell like cannabis, and it's water soluble. You can just chug it down, and you're done with your medicating or with that product. The product underneath that is True Powder, and that is a water soluble powder. Comes in a citrus flavor, vanilla, and non-flavored. And it brings a little scoop. It kind of smells like creatine or like a protein powder. And you just pick up a scoop if that's where your dose is gonna be. The scoop is 5 milligrams. And then you just put it in your whatever beverage you're using. Recommended in a warm beverage best, like maybe a tea or a coffee. But also you can definitely put it in a smoothie. Very discreet. No one's gonna know that's cannabis again. And very easy to dose. Each scoop is 5 milligrams. And then the bottom picture is for True Tincture Drops. And you're going to be like, lady, those are not drops, those are lozenges. But every single product over the 200, we have over 250 products at Trulieve. Every single product has to go through a review with the state. And, you know, there are certain things that can be named certain things. And for example, the edibles or something that I like to talk about that they can be anything that attracts children. So no coloring, no gummy shapes or anything like that. Well, we couldn't call this lozenges or caps or whatever candy. So 2 tincture drops, and these are also fast acting. You just sort it around your mouth. They come in CBD alone, CBD and THC, and THC by themselves. Very easy to dose, 10 milligrams each. If you're starting off, you can always cut this in half and start with 5 milligrams as well. But all these products are very
all of the, I should point this out, all of the
oh, you have one there.
Yeah, I don't know, but all of the gummies all look the same. This is raspberry.
So the blue raspberry is yellow, the watermelon, the green apple is going to be yellow too, and the shape is going to be the same, and that's just the DOH rules.
Welcome to the state, right? But it does taste like raspberry.
Yeah.
It does do that. But the true, what I found about the true powder is it works great for smoothies.
Yeah.
Yeah, it's really, really helpful. And coffee, that works very well with that.
Yeah, it definitely gives you a boost.
Yeah, and this technology gets right into, in other words, you take a number of your competitors' products, drop it in a cup of coffee, and you see the stuff floating at the top. This stuff dissolves right in.
Yeah,
it makes a big boost. Tell me about our favorite
Delta 8 product. So this is both of our favorite products. In inhalation, the Delta 8. The product comes in TruClear, which is a syringe that you see there, and also comes in the pod, which is the exact same thing that's inside the syringe, but just put in a pod for easy use. So the Delta 8 and Delta 9. That Delta 9 is THC, and so is Delta 8. But Delta 8 produces all the same reliefs that Delta 9 THC provides, but not so much that psychotropic feeling. So for example, our favorite combination, which is that ratio of 3 parts of 1 to 1 to 1, you're going to see that it has Delta 8 and CBD, which is not psychotropic as like Delta 9 would be, and then it has a tiny bit of Delta 9. For some reason, that combination from Marc and myself gives us so much balance, and it's exactly what he said. It gets rid of the pain, but doesn't leave you sedated. It actually helps me focus so much more, and get things done. The pain goes away and productivity goes up. It's just amazing. And a lot of patients do describe the feeling as quote unquote feeling normal again.
Yeah, it really is amazing. I mean, I told, when I worked with my knee operation, worked with my doctor, I was working with doctors at Jewett Orthopedics, and I had 5 doctors. There were 5 other patients involved in the study. Anyway, the bottom line is when I told him, I said, look, this works as well as Percocet without all the negative side effects. My doctor looked at me like I was crazy. Roll this forward, about 3 months later, his wife got into medical cannabis and had a pain problem. And he called me up and said, what should I try? And I told him, and he called me back and said, she says it works.
It's real. Yeah.
I said, yeah, of course, Dr. Constance. But anyway, my point is that it really is amazing. I mean, there are some things where you're not high. I carry that pin with me constantly because it's something that it's kind of like my little teddy bear. I know that when I have that, I can attack my pain. That's something I'm very concerned about. Yeah. So let's talk about just in general. Now that we've gone through cannabis, we've gone about Trulieve. Also, I think there's an important part of this. You need to also pay attention to your lifestyle and your diet and basic self-care. I think there's this stuff is not magic wand and it's not fairy dust. It works in combination with you taking care of yourself. And I think if you put all those together, you'll find you're on the road to being able to do some things that you've never really done before. I know that's one of my things is really working on the different things that the nutrition, the diet, self-care. I've recently become I've been into Tai Chi for about 3 years, but I really the last 6 weeks I've become a fanatic. I've joined a temple, if you can believe it.
Nice.
Yeah.
Awesome. That's awesome. It's really important. Let me ask you something. Does cannabis help you get more into it?
Yes, I'll tell you what it does is Tai Chi is a very smooth and easy movement, and a lot of it has to do with your mental state and your mental health. And it just helps you I found that CBD especially just helps you get into that Zen mode that really puts you in. When you get in that, you can feel how all those different components work. I didn't realize when I did my Tai Chi before I did it off the internet, I didn't really do it right. My feet weren't right. My body positions weren't right. So when I got into this temple, they corrected a lot of that. I didn't realize how much benefit your body gets from that. It really is amazing.
Wow.
And your answer to your question is yes. It's something that helps quite a bit,
Yeah.
in being able to
And
do
when I
it.
talk about nutrition and diet, especially when you're experiencing pain or any type of ailment that doesn't let you cook for yourself like you used to, just bringing back the cannabis, the how it gives you motivation. Actually, that I found that, in the kitchen when I was sick,
Mhm.
it would give me, it would help me with the fatigue, but it was also would help me with my taste buds and my
Right,
motivation,
right.
with the food and eating it with a good sense of, I'm putting something good in my body to help me. And definitely nutrition and diet is key. Cannabis is not a cure-all. Cannabis is not just gonna take
Yeah.
everything away and disappear all the ailments and issues. But of course, nutrition and diet and the whole, like how you're doing the Tai Chi, meditation, the praying, the being with yourself, and um giving yourself the time to spend on yourself. We're always on
It's
a
it,
rush, trying to take care of other things and other
yeah,
people, but putting the time for the exactly what it says right here on the slide, basic self-care.
right.
It's basic, but we don't do it often, and it's not basic for us, so
Right.
we need to make it basic self-care.
And it's done an awful lot. It's done an awful lot to help, especially one of my problems with my knee, my balance. And it's done a tremendous amount. And in just the 6 weeks I've been working at, it's done a lot of work on that. I
And
didn't realize my balance problem. But
amazing.
anyway, the point I'm making is this isn't, you can use cannabis with other things. It's something that should be part of your lifestyle. But please pay attention to your diet. And also just pay attention to yourself. Taking 5 minutes and just getting yourself composed is something I think is very important. I know I was an athlete, I was a golfer, and I used to always spend at least 15 minutes by myself before I played a round, competitive round. I
Definitely,
just kind of
definitely.
I had to get in my zone. I had to get into my head. I had to get into my regime. It basically calmed down the butterflies, calmed down everything, and put me in the area that I really wanted to be. And when I couldn't do that, I didn't play well. I mean,
Yeah,
that was.
yeah.
But I think it's the same thing with life. Is just take 5 minutes. Take 5 minutes for yourself. Really, if that's really an important part of it.
I
So
like to say be selfish with yourself, because if
yeah.
you're not gonna be selfish with yourself, nobody is.
So Beth asked a good question. If I am using one-to-one during the day, should I add CBD for sheath health? I have plenty. It says I have pretty awful nerve pain. What's your thoughts?
Well, if you're using a one-to-one, you're already putting CBD into your regimen. You could add more CBD, but if you have pretty awful nerve pain, like Mark was saying earlier in a previous slide, that 20-to-1 ratio that we were talking about, not to jump into something like that, but maybe more of maybe a 4-to-1 or an 8-to-1,
Yeah,
a little bit more. I'm not a doctor, again, talk to your doctor, but if you're already doing CBD and THC, maybe it's time to increase maybe the THC a little bit more. What do you think, Mark?
yeah. I think that look, the guide is, and you mentioned in the beginning of the presentation, CBD really helps with inflammation. THC really helps with pain. If you're using a one-to-one and you have a pain problem, it's okay to change the dosing, by meaning the formula. Instead of using one-to-one, you might go to a 2 THC to 1 CBD. That's another option. Okay. In my case, I went to a 4 and found that worked out very, very effectively. You don't have to jump into the 10-to-1s or 20-to-1s. You don't have to jump out of a hair with jump out of an airplane with a hair on fire to be able to get this done. Just increase it slightly, and I think you'll find the ratio that's out there. Don't be afraid of THC, especially if you use it in moderation. Okay, if you go from a 1-to-1 to a 2-to-1 or 4-to-1, you're using it in moderation. Be careful if you go past that, though. Okay, but my point is, especially if you have pain, your pain's going to go away because of THC. It's not going to go away. Now, what CBD will do is reduce the inflammation, and in reducing the inflammation, it will reduce the pain caused by the inflammation. So I'm not going to say CBD doesn't reduce the pain, but it's not a direct relationship. It's reducing the inflammation, which reduces the pain. It's something that might be out there. So I don't know if that, I know Beth, if that answered your question or not, but hopefully that answered that particular question. So I'm going to open this, go back and open this up to a group discussion. If there's any more questions that people have, please ask. That's what we're here for. Our goal is to really inform you and to provide the information you need to be able to go forward. And as I mentioned, our goal is if we help one person get their life back tonight, we think we've accomplished what we wanted to accomplish. And there's a lot of this program. It's like drinking water out of a fire hose. There's a lot of information.
Yeah.
So be aware that as a follow-up, you'll get an email, and that email will have a link to a page. And that page will have the YouTube video on it, so you can watch this again. It'll have a copy of the presentation. It'll have a copy of all the resources that we use, the resource slides that are there, and it'll have reference material that you'll be able to look up. So you'll be able to replay this, and please feel free not only to review it yourself, pass it on to your friends, pass it on to other people that potentially could help doing that. It's something that's really, really important. We have one other question that says, if you are smoking flower, is it beneficial to take CBD when you smoke flower? What's your thoughts, Jenifer?
Yeah, sure. I mean, it's gonna decrease the effects of the THC because it's not gonna make you feel so psychotropic, but definitely, I mean, I see CBD, and I've spoken to many doctors about this, more like a supplement, like a daily use type of thing, the CBD.
Mm-hmm.
It's beneficial to take CBD all the time.
Yeah. Yeah.
Keep that inflammation down in a level.
Yeah. Yeah. I think that you're not going to hurt yourself using CBD. That's for sure. And I know that when I have inflammation problems, it's the best solution that I've found. So please feel free to do that. I should mention that not only are you going to get a follow-up to this, but next week the webinar is going to be on dosing. So we're going to talk about dosing. What is it? How does it work? What is microdosing? When do you know when to increase the CBD to THC? Not only just CBD, THC, but what terpenes. Also, we're going to talk about the quantities, 25 milliliters versus 40 milliliters. Or I'm sorry. So there's going to be a lot covered. Probably one of the most important webinars we'll have this year is on dosing. And then in 2 weeks, Jenifer, you're back to help talk about cancer.
I will. Yeah, and I can smile about it and feel good about it. Thank God I'm here. But of course, cannabis was a pivotal part of my life, just making the decisions I had to make with my healthcare. So we'll talk a little bit about that when I return. But one last thing that I wanted to mention is that, I ask you guys to, once you start and you decide that you want to embark in this cannabis journey, to have patience. This is not something that's gonna, you're gonna feel the effects of relief, probably immediately, but not maybe the precise effects that you were looking for. And it's gonna take a while. Have patience, trial and error. At Trulieve, we have an amazing exchange policy, and it's a no question asked policy. If whatever you purchased does not agree with you, maybe it doesn't work for you, makes you feel bad, whatever the case might be, we will exchange it for something else until you are able to figure out what works for you. And I think that's super huge.
That's very important. Very, very important. So you have no risk try. Let's put it that way. That's what's very important. Now we had one last question that came in, and it says, how do you get the ratio mentioned if everything looks pre-made?
So yeah, you can make whatever ratio you would want to, as long as you have a THC product and a CBD product, and you combine those as whatever proportion, half and half, or a little bit more of CBD than THC. But we already have, dispensaries have different ratios already pre-made. These are ratios that have seemed to work for many other populations in like other states and things like that. Feedback that we get from the physicians. But you can definitely make your own ratios.
Yeah, and you might feel free to understand that even though they're made for you, you can know what's in there. Okay, just ask the person behind the counter. You'll be able to take the container itself and put your cell phone up to the side of it. It'll tell you what's in there and what ratios when it was tested. That's what's really important. So you know what's in there before you buy it. Let's put it that way. It's not a mystery. It's not a guessing game that's out there. Again, the person at the counter will help you as well as the carton itself will help you quite a bit.
Yeah. And also, I wanted to mention, look how beautiful the stores are. Right behind Marc is what one of our dispensaries looks like. They're very safe, very clean, easy access. Everyone's very friendly. You can spend as much time as you want in that counter in the sales floor, asking all the questions that you need to. Don't ever feel any type of way. We are here all together to help each other out.
Yeah, and I think that's important. I think a lot of people, when I first went to a dispensary, I didn't know if I was going to see Cheech and Chong's Hangout or what I was going to. And basically, I'm a geek, so excuse me if I compared it, but it was like an
Yeah.
Apple store. It was
Yeah.
neat, clean.
Mhm.
Everybody was competent. Everybody was trained. They really are. These are professional. These are professional operations. And I know that there's a whole recreational side of cannabis, and I'm for it, but I don't promote it because I'm mainly in the medical cannabis business. But I can tell you from a medical cannabis standpoint, Trulieve does a great job, and a lot of other dispensaries too do a great job of making sure the products they have,
Mhm.
and they claim match what's in the bottle is what they have. The state requires that, but they also have people there that can help you figure out what's there and what works.
Definitely.
So I want to thank everyone for taking the time tonight to spend some time to drill down on this topic of neuropathy. I think it's an important subject, and I think it's one that hopefully one person was helped. We're there, but hopefully we help more than that. Your last comments, Jenifer?
Thank you, Mark, for having me again and giving me the space to speak to everyone. I love speaking about cannabis. It's my passion, and I love helping people. Another
Yeah.
great passion of mine. And if you guys are hesitant, again, like I always end every debate, look up the endocannabinoid system, how it functions. It's your body telling you that you feel a certain way, and you have this access to help yourself get balance from a natural plant. So if you take anything from tonight, look up the endocannabinoid system, and then also look the functionality of terpenes.
Great, we appreciate that. Before I sign off, I want to naturally thank, I want to thank Jenifer, and I want to thank Deja and Lee. They're in the background, you don't see them, but they help quite a bit with questions and helping to organize this. We don't make this happen without them. And there's one lady that I do mention constantly, Alyssa Katera. She's the one who came up with the concept of CannaChats, and she's kind of the person that got this boat launch, so she deserves some credit. Anyway, I want to thank everybody for joining us tonight. Please look forward to you should be getting an email that comes out, and please feel free to let us know what you think about this webinar. Again, thank you and have a good evening.
Thank you all.